Well, good morning, and thank you all for joining us here in Howard County. It's been quite some time since all of us have been able to gather together, and I first want to thank my colleagues from many other jurisdictions around the state who have been fantastic partners in serving our residents, our businesses, and our visitors. Our ability to be together today is a testament to the hard work and collaboration over the last 20 months. The pandemic highlighted many of the cracks in our community, including access to affordable health care. This is especially true for our young people who often don't have access to insurance through jobs or who have otherwise found it unaffordable. One indicator of concern is that Howard County is experiencing an increase in emergency room visits by our young people. And greater access to health insurance could provide the preventative care these young people need to avoid a potentially crisis situation. But today is about progress, about a step in the right direction. A new state subsidy will make health insurance far more affordable for young adults during our new open enrollment period, which will be starting this coming Monday, November 1st. These subsidies will make an immense impact for residents who currently find health insurance out of reach. A 28-year-old in Howard County earning approximately $30,000 per year can sign up on November 1st for a gold health care plan in 2022 for as little as $1 per month. Previously, this plan could have cost approximately $70 per month. We want our young adults in Howard County and throughout the state of Maryland to know they can now have access to affordable, good health insurance and keep themselves and their loved ones safe. Health insurance is also a critical pathway to receiving, for our young people, mental health services. In the past 5 years, the percentage of young people experiencing anxiety and depression has doubled. And a significant barrier to receiving mental health care is lack of insurance. This progress would not be possible without the legislation supported by Senator Brian Feldman and Delegate Kerr and the advocacy of our friends at Maryland Citizens Health Initiative and especially Vinnie DeMarco. These new subsidies built on the collaborative advocacy for more affordable health care for all. Just before the pandemic, we were gathered here to kick off Maryland's new Prescription Drug Advisory Board, ensuring that our residents can afford life-saving medications. Throughout the pandemic and in partnership with the exchange, we enrolled nearly 1,000 Howard Countians. 1,000 Howard Countians now have health insurance. And these new subsidies will enable us to reach even more individuals. For many of us, these past 2 years have made it crystal clear that health care is a right. And it's a critical piece of our society. We must continue to work together for a community where it is guaranteed for all. I thank you so much, and now I'd like to turn the program over to Vinnie DeMarco.
I want to really thank Howard County Executive Calvin Ball. Let's have a big hand for Calvin Ball for hosting this event and for all he does to be a great public health leader. County Executive Ball recently lost his father, and for that we're all very sad, and I'd like to have just a couple seconds of silence in honor of Mr. Ball's father. We are here today as, okay, no problem. We are here today, as the county executive said, to celebrate good news. There's really great news for Marylanders in incredibly new subsidies starting Monday for people applying for health care under the Affordable Care Act. You're going to hear a lot about it, but let me just start with our basic message today. If you are uninsured in Maryland, on Monday, November 1, go to marylandhealthconnection.gov, marylandhealthconnection.gov, and you will find, we hope, affordable health care. You're going to hear more details about it, but that's our message. We want to thank President Biden, Vice President Harris, and the U.S. Congress for passing the American Rescue Plan, which increased subsidies, and, of course, Senator Brian Feldman, Delegate Ken Kerr for the bill which increased subsidies for young people in Maryland. And that couldn't have happened without Howard County's own budget chair, Senator Guy Gazzone. Diana Peel is here representing him. Without him, this couldn't have happened. We thank Senator Gazzone. So you're going to hear a lot about this, but that's the basic message. On November 1, a lot more subsidies available for Marylanders, particularly age 18 to 34. Go to marylandhealthconnection.gov. So we're going to hear from our leaders today. We're going to talk to you about how important this is. And we're going to start with Howard County Executive Barry Glassman, who's been a leader on public health, on prescription drug affordability, and he exemplifies the bipartisan support for these measures, which, by the way, and Senator Feldman will tell you more about this, passed unanimously in the U.S. Senate. So let's hear first from County Executive Barry Glassman.
Thank you, Vinny, and Harford County Executive. I know we get...
Harford County Executive. I'm sorry.
County Executive Ball and I are used to that. We get switched up a lot, and sometimes lately I do have to check myself to make sure I'm in what county I'm in. But listen, it's a pleasure to be here. I want to thank Vinny DeMarco and the initiative group for having me here. There's a couple of points quite clearly that I want to make, and I'm so thankful to the delegate and my good friend Brian Feldman, who I served on Senate Finance Committee with for a number of years, for their work on this. But a couple issues here I'd like to, as representing a smaller suburban rural county, is that folks 18 to 34 need health care throughout Maryland. Not only in our larger jurisdictions, but in our smaller rural counties on the Eastern Shore, Western Maryland, even in the northern ends of Harford County that do not have health care. This now opens the door for that generation of young people to access health care for themselves. Number two, and Vinny mentioned, how many times do we get a unanimous vote in the U.S. Senate, right? Nowadays. But health care, like prescription drug affordability, health care is a nonpartisan issue. Listen, whether you're a Democrat, Republican, or independent, you deserve basic health care and access to affordable health care. And so, as the lone Republican in the big 8 counties, and I'm so appreciative of my collegial working relationship with each of them, I want to be a voice for out there for everyone to sign up, access this care throughout Maryland. So thank you all so much for including Harford County in this and me. We appreciate all your work. Thank you so much.
Thank you. Thank you very much, Harford County Executive Barry Glassman. I know that very well. A little senior slip here. I know Harford County Executive Glassman and Prince George's County Executive Alsobrooks have to leave early, but we thank him for coming to showing the bipartisan support. Maryland is so lucky to have a crop of really wonderful local executives who are leading the way. County Executive Ball has been really out there, as has Prince George's County Executive Angela Alsobrooks. I've been so impressed. From when she took office, she made public health a priority. She has fought for it. She has done so much for Prince George's County and helping us advocate in Annapolis for the whole state. And we're honored to have her with us here. County Executive Angela Alsobrooks, Prince George's County.
Well, good morning, everyone. It really is a pleasure to be here today. First of all, I do want to honor the leader of this House, County Executive Ball, and thank him so much for hosting us this morning. And I'm also just delighted to be here with my other colleagues from across the state. I think what County Executive Glassman just said is absolutely true. It is the reason that each of us wakes up each morning and does this work is because we care for all Marylanders. Our work is not limited to our boundaries. It is not the case that we work just for Prince George's or Howard or Montgomery or Anne Arundel, but we work on behalf of all Marylanders, and we recognize the importance of issues like this one. Healthcare absolutely is a right. It is not a privilege. And one of the things that we were able to see so clearly, especially during the pandemic, was that it is just so powerful when we come together, how much we're able to accomplish. And we have committed to ensuring that we not only recover from the pandemic and get back to where we were. That's not the goal. It is to go further than we've ever gone before. And I think today represents that kind of progress. And so, again, I want to thank County Executive Ball and Maryland Citizens Health Initiative for hosting this important event today. And I also want to acknowledge the work of the Maryland General Assembly to pass the legislation creating the state subsidies program, and thank again Senator Feldman and Delegate Kerr for sponsoring this important bill. We must make it known to everyone in Prince George's County and across the state that thanks to their efforts and everyone who helped champion this legislation, that health care is now affordable for our younger residents. The General Assembly continues to do the important work to make sure residents have affordable health insurance. And while Prince George's County has also made progress enrolling residents in health insurance over the last decade, we know that more needs to be done and more can be done. We understand that many young adults generally feel that they can survive without health coverage. This is what we know of young people who feel invincible. But many also may not have access to coverage. So in 2019, the number of Prince Georgians, for example, who were unable to afford to see a doctor was at 12.3%. That percentage was driven by adults in the 18 to 44-year-old age group. And recent surveys have shown that in Prince George's County, the number of residents without health care is in the lowest quarter of Maryland counties. That was where we were when before COVID-19 unexpectedly entered our community, and the pandemic hit our county extremely hard. COVID-19 did not just target older residents, but we know that younger residents definitely felt its impact as well. The last 18 months made it painfully clear how important it is to have continuous health care coverage, because you never know when you may need it. So this legislation is right on time for our residents and for all Marylanders. Quality health care is now accessible to more people. We know that now up to $20 million per year in state financial assistance over the next 2 years will bring down premium costs significantly for our young residents and help them to keep continuing coverage. Now is the perfect time for young adults to find affordable health care insurance in the private market, and we're here today to encourage them to do so. I urge all young adults who are looking for coverage in the private market to take advantage of these new subsidies and sign up for the coverage. And thanks to President Biden, Vice President Harris, and the United States Congress, the financial assistance made available under the American Rescue Plan will help lower insurance costs for all Marylanders. So I urge anyone who does not presently have health care coverage to take advantage of this opportunity as well. And so I'm proud to stand today with other county executives and state leadership as we make this plea with one voice. And what we know is when more people get covered, premium costs come down for everyone. We recognize as well that a healthy, insured Prince George's County benefits Montgomery County. A healthy Howard County benefits Baltimore County. Higher health insurance coverage rates in Frederick County, Anne Arundel County, and Hartford benefit us all and makes us a stronger, healthier state. So during this open enrollment period that begins again on Monday, we want everyone to please take advantage and to get this affordable health care insurance. Help us to build a stronger, healthier Maryland so our state can serve as a model for the rest of the country. Thank you all so much, and thanks again to County Executive Ball for hosting us today.
Thank you. Thank you, County Executive Alsobrooks, for your leadership here and everywhere. We are so lucky in Maryland to have such great leaders, and among, of course, them is Montgomery County Executive Mark Elrick, who ran on the health care issue and has been making health care a priority in Montgomery County, and he's been there with us to pass all our great laws on prescription drug affordability and this law on youth subsidies. So we're thrilled that he's here continuing his health care advocacy with us today. County Executive Elrick.
So thank you. Thank you, Calvin, for hosting us. Thank everybody for joining us here. And Vinny, especially thank you. I think the first time I voted for something you had brought before a body was when I was on the Tacoma Park City Council, probably 20 years ago, and you asked us to support, I think, a piece of legislation supporting health care for all. So it's been a long time. You will go down in the Maryland Hall of Fame in terms of health care. So thank you so much for what you've done. It's really been extraordinary. So this is really important for people. I have this quote from the founder, co-founder and guitarist Paul Stanley from KISS, and he says, "Youth is incredible because you really do feel invincible." I think all of us have been through those moments. We probably did things that invincible or non-invincible people wouldn't have contemplated, and we all managed to survive it, but we do know that the ages of 18 to 34 are difficult, and many young people do not believe they need health insurance. And then when they do get hit with something that requires health insurance, the financial costs and the burdens on them are extraordinary. So young adults aren't any different today probably than they were when we were growing up. According to the CDC, adults age 18 to 34 had the highest uninsured rates of any group in our nation. People in this age group had an average uninsured rate of 15.6%, compared to 5.7% for those under 19, 11.3% for adult ages 35 to 64, and 0.8% for individuals 65 and older. And I got to hand it to individuals 65 and older in our county. Almost every one of them is vaccinated, which is pretty remarkable. These numbers are even more sobering when you include the provision that was included in the Affordable Care Act that allows young adults to stay on their parents' health care that was expanded to the age of 26. And this is why it's so important for us to gather today, make sure we get the news of this open enrollment time and these subsidies out to our young adults or to their parents. I think people have kind of been brought along with this idea that the health care is unaffordable and too expensive. A lot of people don't even try. We need to let people know it is worth trying. These subsidies absolutely make it affordable to people. We want to ensure that all Montgomery County and Maryland residents are covered with insurance, that it's critical to their health and my equity goal in Montgomery County. We cannot have equity with the health disparities that exist today. And we know from COVID that mortality rates are deeply tied to lingering inequalities in access to health care. It was not a sudden thing that people suddenly appeared with comorbidities. Those comorbidities are rooted in the lack of health care that begins even at a young age. I'm very appreciative of the work by my own Senator Brian Feldman, along with Delegate Kerr, and the Assembly for providing these critical funds to reduce the health care costs. I'm also thankful for the continued advocacy and outreach of the Maryland Citizens Health Initiative, the Maryland Health Benefit Exchange, and their community partners throughout the state for consistently fighting to make us the healthiest state in this nation. And as the pandemic rages on, as well as thousands of ailments, accidents, and illnesses that can be encountered, it's even more important for young adults to enroll for health care coverage. And I will say about the pandemic, while deaths get the headline, the hidden story in all this is the persistent long-term effects of COVID. And anybody who's read the articles about the number of people with those persistent long-term effects, and long-term can mean a year or more, those folks are going to need health care going forward. It's absolutely critical they get access to it. They should not be so sure that getting COVID is a one-and-done experience. It may last with you for a while. The last 21 months have demonstrated these inequities, and the success, organization, and communication we utilized on COVID should not end when we get back to normal. We need to make sure that even as things become more normal, we continue to push on people to take advantage of these healthcare programs. It is important for everybody's well-being. And this kind of engagement has to continue throughout the state. It's no surprise that I've been a supporter of universal health care. I don't understand how a civilized industrial nation does not have universal health care. I don't understand how people turn their back on folks who aren't just in need, but people who are sick and can't find their way to a doctor or a hospital. It is unbecoming of one of the leaders in the world and one of the economic powers in the world to have so many people without access to health care. I'm pleased that there's progress at the federal level. It is great to see that the new administration has brought more resources to bear on this. And I just want to thank you, Vinny, from all my colleagues, from people in my county who know you from every battle you have been in. Thank you. You make a difference.
Thank you. Thank you, Mr. County Executive, for those kind words, and we appreciate your support. County Executive Jan Gardner of Frederick County was on her way here, was called back for an emergency, but she wanted me to pass on to everybody her strong support, and her goal is going to be to get the message out to folks in Frederick County about this new subsidies, and we have Delegate Kerr from Frederick County in a few minutes will speak. Next is County Executive Stuart Pittman from Anne Arundel County, and he has been a tremendous public health leader in Anne Arundel County and around the state. He and County Executive Glassman did a TV ad together, which made a big difference on Prescription Drug Affordability Board, and I've seen him really do great work in Anne Arundel County in healthcare, and thank you for his support for this legislation and for getting the message out. County Executive Pittman.
Thank you, Vinny, and it's thrilling to be with my next door neighbors, my friend and partner, Dr. Calvin Ball, and all of the other county executives and leaders in the General Assembly who made this happen, and particularly Vinny DeMarco and his team who always are at the cutting edge of making sure that Maryland is leading the country on health care. And there is nothing more important than this. I ran for office because we had people in our communities without health care. And at the end of the day, for everybody, nothing matters more than your health or your loved one's health or your community's health. So speaking directly to the folks who are in the 18 to 34 age group, please, 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 you are not invincible. You do need health insurance. Health insurance is now affordable, very affordable, thanks to this new legislation. So please, if you aren't insured, please call and get insured through the health exchange. And if you know anybody in your family or your friends who is of that age group and is not insured, please do that. It's good for business in this community. It's good for our economy. It makes Maryland a leader, and it saves lives. So I'm just thrilled to be here, and thank you, everybody who's done this work.
Thank you. Thank you very much. And to show the unanimity, we also have great support from Baltimore County Executive Johnny Olszewski and my own mayor, Brandon Scott. Neither of them could be here, but they sent videos. So why don't we play the two videos for you. Baltimore County Executive Johnny Olszewski, followed right after that by Mayor Brandon Scott.
Hey everyone, I'm Baltimore County Executive Johnny Olszewski, and I am thrilled to help spread the word that more affordable coverage will be available to Marylanders this fall. Uninsured Marylanders can sign up for health coverage during open enrollment, which starts November 1st at the Maryland Health Connection. New financial assistance from the American Rescue Plan makes coverage more affordable in our state. Plus, thanks to a new state-funded subsidies program, young adults from 18 to 34 can get even more financial help. Free help is available to pick a plan that is right for you and your family. As county executive, I encourage uninsured residents in Baltimore County and beyond to visit marylandhealthconnection.gov to sign up and get your health coverage.
I'm thrilled that uninsured Marylanders can sign up for health coverage during open enrollment starting November 1st at Maryland Health Connection. Even better, new financial assistance from the American Rescue Plan will make coverage more affordable for Baltimore City residents. Plus, thanks to a new state-funded subsidies pilot program, young adults aged 18 to 34 will be able to get even more financial help. As mayor, I encourage our uninsured residents in Baltimore, and you know who you are, to visit marylandhealthconnection.gov to sign up for health coverage and get some peace of mind. Free help is available to pick a plan that is right for you and for your family. Again, that's marylandhealthconnection.gov. Sign up now and get covered.
All of this has only been possible because of our leaders in the legislature. I'm going to ask Senator Brian Feldman and Delegate Kerr to come up together and address you. Senator Brian Feldman is the Vice Chair of the Senate Finance Committee and co-chairs the Health Insurance Coverage Protection Commission. And in those two roles, he has been one of the top leaders in Maryland in making health care happen, reducing premium costs, expanding health care coverage. He is just a great leader in Maryland and a national spokesperson on health care. Delegate Kerr of Frederick County serves on the Health and Government Operations Committee of the House, and in that committee has fought hard for health care progress. The two of them were the lead sponsors of this bill, which was not an easy bill to get through. They got it through. They got the money, and I want to thank them so much and have them address you. Senator, Delegate.
Well, thank you, Vinny. I'm just going to be very brief. I want to thank you, Vinny, for putting this together, my good friend Calvin Ball for hosting. I do want to make an important point at the outset. A lot has been written about the fact that Maryland really is the innovative leader in the nation among states in health care. It was mentioned the first in the nation pharmaceutical drug pricing board, first again in the nation. Just last week, Vinny and I did a press conference with Senator Chris Van Hollen about another first-in-the-nation proposal bill that's in law now in Maryland, the so-called Easy Enrollment Program, where if you don't have health insurance, you check a box on your state tax return, and that information, your financial information, is shared with the exchange to see if you're eligible for federal tax credits, for Medicaid. A lot of folks don't even know they're eligible. So we rolled that out about a year or two ago. I sponsored the bill with Delegate Melnick from Prince George's, and that has caught fire all over the country at the state level, so much so that Senator Van Hollen last week did a press conference where he announced that he's introducing this Maryland idea nationally in the United States Senate, and he got a House sponsor from California. So some of these ideas are absolutely rising to the level of national attention. I just want to highlight that point. I do want to give a shout out to Delegate Melnick. We do share this Health Insurance Coverage Protection Commission where a lot of these innovative ideas have been vetted the last few years. So I want to give her a shout out. She's not here today. Which turns me to this particular bill, the Young Adult Subsidy Program. It was similarly a great opportunity to work with Delegate Kerr. First, maybe not the first in the nation, but we borrowed an idea from Massachusetts, quite candidly, this idea of providing a $20 million per year over the next 2-year subsidy for young, low-income young adults, focusing on that 18 to 34 age category. It's a 2-year pilot. It's not only great for those folks to get health insurance and help them get health insurance, but it brings down the premiums for everybody else. We have to have young, healthy people in the risk pool. And the more healthy people you have in the risk pool, it helps the premiums come down for everybody else. So it's a great, great idea. I'm so happy to have collaborated with Delegate Kerr on it. And if it works, this 2-year pilot, I hope, will be permanent. And so we'll see how that happens. And finally, none of these programs work unless people know about it. And they know about the programs and they know how to enroll. And that's why it's important that we're all here today to participate, to get the word out that on November 1st we have early enrollment starts. And I want to thank everybody who participated today. So thank you, Vinny. Thank you, Delegate Kerr. And I think I'll stop right there.
Thank you, Senator.
Okay.
This was the first time that Senator Feldman and I collaborated on a bill. I hope that relationship continues. He had a little bit easier time in the Senate than I did in the House, where we did have some opposition. People really didn't understand what it is we're trying to do by providing subsidies at the tune of $20 million a year to bring these young people into the pool. Some of the opposition was suggesting, why don't we just take the $20 million and lower everybody's health insurance? Well, we could have done that, and it would have lowered everybody's health insurance by about $50 a year for the 2 years. But what this bill will do, once we get these young, healthy Marylanders into the exchanges, we will broaden the risk pool, we will stabilize the exchanges, and our data indicates that we can see everyone's premiums drop by 2.5. And that's what we'll show will happen. So I urge all young Marylanders who are uninsured to take advantage November 1st of the open enrollment period. Thanks.
Thank you, Delegate. Well, we're going to now hear from some details. The laws that implement the Affordable Care Act are working in Maryland because we have the best health exchange in the nation. And I talk with people all around the country who are so jealous of ours, and I say, you can't have Michelle Eberly. She's ours. She is just a tremendous leader of the Maryland Health Benefit Exchange, and through rough times and good times, she has made it work, and she has implemented the reinsurance program, the Easy Enrollment program, and now is implementing the Youth Subsidies program in a brilliant fashion. She has a great staff, and I'm thrilled she's here with us to talk a little bit about the details. Michelle, all yours.
Thank you so much, Vinny, and thank you for your efforts to pull us all together, and thank you to County Executive Ball for providing this space for us. You've heard from all these county executives and our legislators, and I'm so humbled that everyone took time out of their day to be here to talk about the importance of health care and getting health care. You all know, as folks that consume health care, without our health, we have nothing. You can't go to school, you can't learn, you can't go to work, make a living. Everything you do is predicated on your health, and the livelihood you lead is predicated on your health. We are so fortunate in Maryland that we not only have all these great folks up here with me today who are so supportive of healthcare, that we've got an administration that's supportive of healthcare, and that we really have pushed efforts forward to make it more affordable in Maryland. And in fact, our insurance premiums are some of the lowest in the entire nation. And not only are our health insurance premiums low, but the quality of the coverage that we offer is very solid and strong, and people forget that we have a lot of wellness coverage that is built into our health plans, such as immunizations, your COVID immunizations, just immunizations to go to school, your cancer screenings, all sorts of things that just by mere fact of having health insurance are covered. Getting your diabetes screening. On our value plans, you can get diabetes supplies at no cost. And so we're constantly looking at not only the cost of health care, but the quality of health care. And when we look at the plans that we are offering through the exchange, we look at how do these address health inequities in our state? What are the priorities of our state? And how can we help deliver benefit designs that really will allow people to be able, one, to afford it, to use the coverage, and to drive down some of those conditions that are so problematic for so many of Marylanders. As everyone has said today, we are very fortunate with the Young Adult Subsidy Program. This is, I would say, the third initiative we've done to help lower costs of health care. We started with the reinsurance program that drove prices down. We did the special enrollment period that got more people enrolled. And now with the Young Adult Subsidy, it is going to make it so affordable for people to have health coverage. $1 a month. I encourage all mothers, girlfriends, aunts, because we know as women we're usually the caretakers, to say, go take care of your health. So I'm challenging all of you mothers, aunts, girlfriends, sisters, tell everyone you know that's between the age of 18 and 34. This is the year. This is the year to get coverage. It will cost you less than 3 fancy coffee drinks for the entire year. You have all your wellness benefits covered, so you will be getting something from day one for that $12 or so that you'll pay for the year. So please encourage everyone to get coverage, again, through the American Rescue Plan this year. Not only are younger folks getting more subsidies or more tax credits, but we found for the first time ever that those families in the higher income ranges are now getting tax subsidies. So it's become affordable for everyone. We saw the need during the pandemic. Since pre-pandemic, we had an increase in enrollments of 25%, which is huge. That's in a 1.5 year period of time. So healthcare is important, it's needed, it's affordable. Your job now is to help all of us up here get people enrolled, and with that, there is a whole box of brochures that you can take in English on one side, Spanish on the other, gives all information. We have now, the exchange, we've incorporated a QR code, so you can just click on that QR code and get all sorts of information. We have people all across the state ready and willing and able to even come to you in the comfort of your home through video or in person to really help you get coverage. So there's no reason not to this year. And again, thank you so much, Vinny, and thank you, county executives and Senator Feldman and Delegate Kerr, who have been so supportive of everything we've done. This is the year to get health coverage.
Thank you, Michelle. Thank you for your leadership. As you can see from this chart, that age group of 18 to 34 that this legislation addresses is the highest group that's still uninsured that we need to reach. So that's why this is so important. Let me just close with, there's recent studies showing Maryland's the 5th best healthcare coverage in the nation and the 6th highest rate of vaccinations. We're making a lot of progress. We're doing great, but we got to do greater. We're at 6% uninsured. We used to be 13%. We want to go to 0 uninsured. This is a big step in that direction. So with that, I want to thank everybody, especially County Executive Ball, for hosting us and open it up for any questions, comments. Yes?
I just want to know, what is the income level for this age bracket?
Do you want to address that, Michelle? Come on up to the mic. Why don't you repeat the questions?
The question was, what's the income bracket for this? So this program is for 18 to 34-year-olds up to 400% of the federal poverty level.
Break that down for us.
It is, I believe it's $50,000 for an individual and up to $100,000 for family.
So if your income is between $50,000 and $100,000, you qualify?
I believe so. I can verify that specifically.
And I have one other question, maybe the Senator, and I think I covered the initial bill going through the General Assembly, but I don't recall the funding source. It's a 2-year pilot.
So Michelle mentioned.
Yeah, to the mic, yeah.
Michelle mentioned one of the great successes the last few years was our reinsurance program, the largest reinsurance program of any state in the nation, which has stabilized our individual market premiums. So that has been so successful. We actually have an abundance of money in there, so we're using some money in there that we don't really need for the year or two to stabilize the market, and it's done everything. So we're tapping a portion of that reinsurance fund money to fund this 2-year pilot project. So, yeah.
This covers medical and dental, right? No.
We'll let our expert. I don't want to misstate anything.
No, this is for medical only. However, thank you for bringing up dental because we have very affordable dental plans on the exchange, and that's been an area we don't talk about a lot, but we've seen like a 60% increase of people purchasing dental plans, and so they're very affordable. We have 4 or 5 carriers, so check them out. And what we found is with lowering premiums on health insurance, more people can afford dental insurance.
Will there be a deductible? I mean, some of the percentage that we're always scared can afford the insurance, but the deductible is so high.
On the health insurance? So we have introduced what we call value plans, and we heard that loud and clear from the community that I have insurance, but I can't use it because my deductible is too high. So 2 things that I want to state about that. One is there's an awful lot of wellness benefits that are pre-deductible, and like I was saying, for diabetes now we've introduced glucometers and diabetic strips and insulin that will all be pre-deductible. And then also we have value plans that have limits on the deductible. So our gold plans have a $1,000 deductible. Our silver plans have a $2,500 deductible. So we've introduced that, as I was saying before, the plans that can make it affordable for people to actually use their coverage.
Another thing we were saying why that number is so high, that they have the feeling, unlike old guys like me, that they're going to live forever. How do you get past that?
Well, that's where I call on moms and aunts and sisters, because I know when I was 18, my mother told me, you will never be without health insurance. Go get yourself a health plan. So I really do, we have to call on our community to rally around, just as we're doing today, to say, you don't know. I always say, you don't know. You might have an unintended pregnancy. You might have an injury where you fall down while you're skiing. I mean, there's all sorts of things. COVID was a prime example. Never expected COVID to happen. So there's, you may feel you're invincible, but think of things that are outside of your control.
I would like to reiterate something County Executive Ball said at the very beginning. He used the example of a young man in Howard County, 30 years old, making $30,000 a year, now pays $70 a month for health insurance, which may be too high. It's now, as of November 1, going to be $1 a month. That's the kind of person this will benefit. And I think as Michelle said in answer to David's question, an individual or family up to 400% of poverty. For an individual, it's up to about $50,000 a year. For a family of four, up to about $100,000. But these are people who have trouble affording the plans now. Under the new subsidies, many, many more people will be able to afford the coverage. Thank you again, County Executive Ball, and everyone.